Jasmine, a third-year medical student at McMaster University at Waterloo campus. I'm here on elective with Dr. Bob Lee at the Waterloo Sports Medicine Center to learn about shoulder instability and exercises you can do with the guidance of a physiotherapist for rehabilitation as well as to prevent shoulder injuries. Your scapula, also known as shoulder blade, and the surrounding posterior muscles are essential components to shoulder stabilization. First exercises Dave is showing Dylan are shoulder retractions, which assist in having proper shoulder positioning for the following shoulder stabilization exercises shown in this video. Scapular retractions consist of drawing the shoulder blades down and inwards. This helps strengthen the posterior muscles and de-emphasize the anterior muscles, which often are in dominance. The idea is to hold this position for a couple of seconds and then disengage the muscles and relax, repeating 10 to 15 times. A series of progression to the first exercise is scapular retractions while lying face down. Starting with your arms at your side, set your shoulder blades by bringing them down and inwards, maintaining this position as you raise the arms 1 centimeter, feeling the posterior muscles in the upper back working. Hold this position for a couple of seconds, then lower the arms down, disengage your upper back muscles, and rest. To make it more challenging, you can place your arms at the level of your head with elbows bent and rotate your palms inward so your thumbs are facing the ceiling. Repeating the same sequence. Set the shoulder blades, elevate the arms 1 centimeter, hold this position for a couple of seconds, lower the arms, and disengage the posterior back muscles. The last progression to the series of exercises involve extending the arms past the head, essentially making the lever arms longer, therefore more challenging, and repeating the same sequence. These exercises can be repeated 10 to 15 times each.
So we'll just go right from the basics.
The following exercise is considered an isometric exercise, meaning contraction of the muscle with no length change. This static strengthening exercise is a great exercise early on in the rehabilitation phase after injury or surgery, as it allows you to strengthen the muscles involved in external rotation without doing range of motion. Hold a resistance band with the arm at 90 degrees and elbow to the side. Set the scapulas and take a step to the side, working on maintaining a stable position. Hold for a couple of seconds as you feel the tension building in the posterior muscles and slowly take a step back to the starting position. This exercise can be done facing both directions, doing 10 to 15 reps with both arms. To make it more challenging, you can increase the number of repetitions, the length of the hold, or the strength of the resistance band.
We're going to sort of move through range, okay? So the same idea, set your shoulder back, okay? And you're going to move through, okay? So think about you're just pivoting that sort of ball in the socket. You want to keep that elbow close to your side. You don't want to see your arm getting away too much here, so a nice stable position.
Now moving on to dynamic shoulder exercises, starting with range of motion of the shoulder, specifically shoulder internal and external rotation. Hold a resistance band with the arm at 90 degrees and elbow at your side. For internal rotation, set the shoulder blades and rotate the shoulder inwards towards your body, making sure to keep the elbow tucked in at the side. To help maintain proper position, you can use a towel between the elbow and body, focusing on not letting the towel fall to the ground. For external rotation, set the shoulder blades and rotate outwards with a brief pause and slowly rotate back to the starting position, focusing on slow and controlled movements throughout. Repeat the internal and external rotation exercises 10 to 15 times each. This exercise is working on external rotation with the arm abducted at 90 degrees using a resistance band tied about half a meter from the floor. Maintaining a stable shoulder, rotate your arm towards the ceiling, keeping the elbow as still as possible. Repeat this exercise 10 to 15 times.
So in, squeeze, and back out.
The following exercises are strengthening exercises to help with stabilization of the shoulder. First exercise shown is seated rows using a cable machine. Again, set the shoulder blades, pull towards you, pause, and slowly release. This exercise is similar to the previous exercise, but from a standing position using one arm at a time. Focus on controlled movements and making sure to not elevate or shrug the shoulder. Repeat these strengthening exercises 10 to 15 times each. The cable diagonal raise exercise focuses on movement in multiple planes as you extend up and to the side with the cable. It is important to keep the weight away from your body and return to the starting position in a slow and controlled manner. This exercise can be done in both directions. When pulling the cable up and across the body, the biceps should come across your chin. You can repeat this exercise 10 to 50 times each with both arms in both directions. The suitcase carry exercise requires a weight held with one hand to the side. Use a weight that is challenging, but that doesn't force you to sacrifice your form. Important first step is to set the scapulas and then take small walking steps about half the size of your normal step, maintaining a stable position. Ideally, you would do 20 to 30 paces one direction and turn around and repeat with the other arm.
So you're going to let that just dangle, let the arm stray too much, so bring the shoulder a little bit right there. Okay, and then what you're going to do is tiny walking steps.
A body blade is a strengthening and proprioceptive tool that can be used in a shoulder rehabilitation program. The idea is to hold the body blade and to keep it in motion while moving the arm forward to 90 degrees. Pause for a few seconds and slowly bring it back to the starting position. You can then move the arm to the side to 90 degrees, hold for a couple of seconds, and slowly bring it back down, all while keeping motion in the body blade. This exercise helps with activation of the muscles in the shoulder as they control the motion of the body blade. Push-up plus exercise involves retraction and protraction of the shoulder blades. In a push-up position, maintaining straight arms, retract the shoulder blades by drawing them down and in. Holding for a few seconds, then protract the shoulder blades by essentially rounding the upper back, moving the shoulder blades away from each other. This exercise strengthens the serratus anterior muscle, which is a scapula stabilizer. Remember to keep the core engaged and hips level. Repeat this exercise 8 to 10 times. This exercise involves maintaining a push-up position on a Bosu Ball and weight transferring in 4 directions. Start by weight transferring side to side and then forward and backwards, keeping the shoulder blades set and stabilized, core engaged, and hips level. Repeat each movement 3 times. This exercise consists of doing a mini push-up with one hand on the Bosu Ball, alternating sides. Remember to keep the core engaged, shoulder blades set, and hips level. Repeat this exercise 8 to 10 times. These shoulder braces are for individuals with shoulder instability that have been cleared to return to sport or physical activity. The Donjoy shoulder stabilizer brace is beneficial in sports and when doing physical activity, especially when it involves doing unpredictable movements, as it helps you stay in a safe zone in terms of range of motion to prevent re-injury. The straps are lettered A to E to assist in properly putting on the brace. Ideally, the brace should be placed with the help of a trainer or teammate. The Sully shoulder brace is an alternative shoulder brace option. The 2 straps are placed with tension over the AC joint and around the chest. These shoulder braces essentially limit your ability to be in a vulnerable position, which is in 90 degrees abduction and 90 degrees external rotation. If your doctor has prescribed you a shoulder brace to wear as you return to sport, visit your local bracing store for further information on the best brace for you. Take-home message for shoulder instability is to see a physiotherapist who will guide you through the different phases of a rehabilitation program to return to physical activity.